Hello everyone, I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. I am the author of Running, Maximize Performance, and Minimize Injuries. Thank you for viewing today's episode of Dr. Ozello's Sports Medicine Report. As you can see, I am seated on a Fitball. Today I'm going to go over Fitball Pelvic Tilt. The pelvic tilt is a basic core strengthening exercise that you can use to strengthen the rectus abdominis, the pelvis muscles, the oblique muscles, the transverse abdominis muscles, and the lower back muscles. In the pelvic tilt, basically you are contracting the lower abdominal muscles and you are shifting the pelvis so that the anterior part of the pelvis, what's called the pubic symphysis, is raising forward towards the belly button, which in medical terms is called the umbilicus. So basically, you can learn how to do it when you are laying supine or you are standing against the wall. So once you get that, then you move to the Fitball Pelvic Tilt. So what I was about to say before is basically this is an intermediate exercise. If you have any type of balance issues or you have pain or just difficulty sitting on a Fitball, then you don't want to do this exercise. But if you can do this exercise, you want to build up to it. Start with the pelvic tilt while you are laying supine or you are standing, and then move to the Fitball Pelvic Tilt. Sitting on the Fitball is also very good for the lumbar spine. And really any of the discs in the spine, but especially in the lumbar spine. The intervertebral disc is located in between the vertebrae. Once we reach the age of 6, we no longer have directed blood flow to the intervertebral disc. The intervertebral disc therefore gets its nutrition and its blood flow through osmosis from the vertebrae above it and the vertebrae below it. What increases that osmosis or just continues it in a healthy format is motion. Sitting on a Fitball is a great way to continue that motion and to strengthen the core muscles at the same time. All right, now it's time for the disclaimer. In the disclaimer, as you know, if you are not exercising currently, please see a medical professional to get an examination, get an evaluation to make sure you are healthy enough for exercise. Once you pass that examination, then start exercising. Work with a fitness professional so that you are doing your exercises correctly. The Fitball is a great tool. It can be very beneficial to strengthen and to stretch many parts of the body, but it has to be used correctly. Many people have gotten injured using the Fitball incorrectly and put themselves in an unsafe position. So please work with a fitness professional or some type of doctor who specializes in rehab, or some type of medical professional who specializes in exercise, who can help you to use the Fitball properly. When performing Fitball Pelvic Tilt, one of the most important things is that you're in a good posture. You want to make sure both feet are firmly on the floor. You want to make sure you're sitting up straight. You don't want to be slouched forward. You don't want to be bent to the side. You don't want to be turned. You want to sit up straight. Be in a good posture. You want to make sure that the neck is in line with the spine, that the shoulders are not pulled forward, that your scapulas are in a neutral position, that your shoulders are in a neutral position. Perform the pelvic tilt, and you want to maintain the pelvic tilt throughout the entire exercise. So again, the pelvic tilt is shifting of the pelvis by contracting the lower abdominal muscles. So this pelvis, I am pretending that I'm holding a pelvis, and you shift it like this. Okay. So I'm going to perform that. I'm going to get into a good posture, perform the pelvic tilt, and then you slowly and lightly bounce on the ball. You're not bouncing way up here like this. You're not fooling around. Okay. You never leave the ball. You're not doing this. Okay. You're sitting in a good position. You hold the pelvic tilt and you bounce very, very slightly. And you hold this position for just a few seconds, and then you shift the body to one side. As you can see, I am maintaining this good posture. I'm maintaining the pelvic tilt, and then you move to the neutral position. And then from that starting position, you go to the opposite side. Very, very simple. Then you move forward. You want to maintain the pelvic tilt position throughout the entire exercise. Once you have moved forward, then you shift to the right. And you will feel how it is hitting and targeting these muscles as you move into the different positions. And then you go backwards, go all the way as far as you can to the opposite side, and then forward. So we have just made a rectangle. And we go back to the starting position. From here, you go the opposite direction. And you're going to target all these muscles in the lower abdominal area, strengthening your core and bringing an increased amount of blood flow to the intervertebral disc. Now this may look simple, but trust me, you start doing this, you will really feel it. You will thank me the next day. You may be mad at me because you're going to be sore, but this is an excellent exercise. And then what you want to do, once you have done a couple repetitions in each direction, then you do an X. So you come to the top, right now moving to the top right, and then to the bottom left, and then go back to the starting position. And throughout the entire time, you hold the pelvic tilt and you maintain your good posture. The Fitball Pelvic Tilt is an outstanding exercise. Learn how to do it correctly, start at your current fitness level, and gradually increase. Remember to always stay in good posture. You want to keep the shoulders and the scapulas in a neutral position. You don't want your shoulders pulling forward. You want your spine straight. You want to make sure that your head is in line with the rest of the spine. You don't want the head coming forward. You don't want the head bending backwards. You don't want to tilt it to the side or turned. You want the neck in line with the spine. Gradually progress, do all the different motions that I spoke about, gradually progress and make the exercise more difficult. You will thank me. You will see the results when you are finished doing the Fitball Pelvic Tilt. But I want to thank you for watching today's video. Please feel free to like this video. Please subscribe to my YouTube page, Dr. Donald A. Ozello, DC. If you have questions, feedback, or suggestions, please leave them in the comment section below. I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. I am the author of Running, Maximize Performance, and Minimize Injuries. Thank you for viewing today's episode of Dr. Ozello Sports Medicine Report. Always remember, train hard, train smart, utilize nutritional strategies that work for you, stay injury-free, and accomplish your goals.